So next we have the calcium channel blockers, okay, in the treatment of hypertension. So calcium channel blockers are used in many conditions, including in treatment of hypertension and arrhythmias. So this group of drugs are a structurally and functionally heterogeneous class of drugs. So they are quite heterogeneous. There are sorts of a few types of calcium channel blockers. So the main mechanism of action is vasodilatation, so which reduces the peripheral vascular resistance. Okay, so which will lead to reduction in the cardiac output. Okay, sorry, it will cause reduction in the blood pressure. So certain subtypes of dihydropyridine calcium channel blockers. Example, we have T-type calcium channel blockers that has been demonstrated. So these drugs have been demonstrated to cause dilatation in both the afferent and also the efferent arterioles, and also reduce the glomerular capillary pressure in the kidney and also reduce proteinuria. Okay, so these mechanisms might play a function in reducing or preventing damage of the kidney and also preserving of the renal function. So because of this effective lowering blood pressure property, and also because of the safety profile of the drug, so calcium channel blockers, especially the dihydropyridine type, have been recommended as first-line antihypertensive agents, okay, by some committees. And meta-analysis have shown that the RAS blockers and also CCBs combinations are better than other combinations in lowering the cardiovascular events, okay, like myocardial infarction, etc. And also they have a better safety profile. So we have the dihydropyridines, such as amlodipine, nifedipine, isradipine, like canidipine, nifedipine. So these are all, especially these ones, are very, very important drugs. And then we have non-dihydropyridines like diltiazem. Okay, we have diltiazem, SR, verapamil, and also verapamil SR. So these these have to be memorized. Okay, we have to memorize dihydropyridines. So nifedipine, amlodipine, etc. So of course you can remember. So D comes before N. Okay, so you have to memorize the D first. So D, important, nifedipine, amlodipine. So these are very, very commonly used drugs by doctors. Okay, so these are, generally speaking, these drugs are more important than this group of drugs. Okay, the dihydropyridines are more important than the non-dihydropyridines. So that's why the dihydropyridines really you have to memorize it, nifedipine, amlodipine, especially, and then only memorize the non-dihydropyridines, the diltiazem and verapamil. So next is the inhibitors of angiotensin. Okay, inhibitors of angiotensin.